Hello, everyone. My name's Garrett from Geisinger Health and Wellness. Welcome to Wellness Wednesday. Now, a disclaimer before we start. Exercise is not without its risks. Individuals, especially those with pre-existing conditions or past injuries, should consult with their healthcare provider before beginning an exercise program. If at any point while exercising you feel faint, dizzy, or experience any pain or physical discomfort, you should stop immediately and consult a healthcare provider. Content provided for this is for informational purposes only and is not intended to be medical advice. Consult your healthcare provider with any questions. Thank you for joining today's Wellness Wednesday session. Today's topic is strength training. Exercise can be confusing, especially when it comes to strength training. Strength training goes by many different names and has a lot of jargon and terminology associated with it. Sometimes the hardest part is knowing where to start. Today we will review common names and terminology, how to start exercise, recommendations, benefits, and overcoming plateaus. We hope you leave today's session with a better understanding of what strength training is, how to decipher some of the fitness jargon, and some examples of what you can do to get started. Now let's break down the three main types of exercise. There's aerobic, resistance, and flexibility. Each one plays a unique role in keeping your body healthy and balanced. Aerobic exercise is all about getting your heart rate up. It improves your heart and lung health, boosts endurance, and helps you burn calories. It involves continuous rhythmic movement. Think of activities like walking, running, cycling, swimming, dancing, or even jumping rope. If it gets you breathing harder and keeps you moving, it's most likely aerobic. Resistance training, also called strength training, helps you build muscle, increase tone, and improve endurance. It works by making your muscles push or pull against the force like weights, resistance bands, machines, or even your own body weight. Some examples include push-ups, squats, weightlifting, and resistance band workouts. This type of training is key for maintaining strength and supporting your joints. And last, flexibility training helps you increase your range of motion, reduce stiffness, and recover better after workouts. It involves stretching muscles and joints through controlled movements. There's two main types of flexibility: static stretching, which is holding a stretch for 30 to 60 seconds to lengthen muscles, which is great for after workouts, and dynamic stretching, which is moving through stretches with control like high knees, leg swings, or arm circles, often used as a warm-up. Today we're focusing on strength training, also known as resistance training. This is a form of exercise where your muscles work against some kind of resistance, like your own body weight, free weights, dumbbells or barbells, resistance bands, or machines. Through this training regimen, we observe a significant increase in strength and muscle growth. This is primarily due to the consistent application of resistance on the muscles over time. Strength training does more than just build muscle. It plays a key role in overall physical health. It helps increase muscle mass, which supports your body in daily activities, and it also improves bone density, which is crucial for preventing osteoporosis as we age. Plus, it enhances joint stability and posture, reducing the risk of injury and helping us move more efficiently. The benefits aren't just physical. Strength training also supports our mental well-being. It is shown to enhance cognitive function and focus, which is especially important as we get older. And it can help reduce symptoms of anxiety thanks to the mood-boosting effects of regular physical activities. One of the most powerful effects of strength training is on our metabolism. By building lean muscle, we naturally burn more calories at rest, even when we're not working out. This makes it a great tool for weight management. Strength training also improves what we call functional fitness, our ability to perform everyday tasks safely and efficiently. It enhances balance, mobility, and coordination, which is especially important for older adults. And by strengthening muscles and joints, it helps prevent injuries and reduces the risk of falls. Finally, strength training supports our long-term health. It's effective in management and even preventing chronic diseases like diabetes, heart disease, and arthritis. And it plays a big role in healthy aging, helping us stay active, independent, and strong well into later life. Before you jump into any new workout routine, it's really important to consult your doctor, especially if you have any pre-existing health conditions, and discuss any medications. They can help you understand any limitations or precautions you should take to stay safe. Next, take a moment to evaluate your current fitness level. How's your strength, endurance, and flexibility? Identify where you're starting from helps you build a plan that fits your needs. After that, let's talk about setting realistic goals. Think about what you want to achieve. Do you want to build muscle, get stronger, improve endurance, lose weight, or just boost your overall health? Whatever your goal is, make sure it's achievable and measurable, and don't forget to celebrate small milestones along the way. They'll keep you motivated and help you adjust your goals as you progress. And finally, start slow and increase intensity gradually. It's easy to get excited and push too hard too soon, but that can lead to injury or burnout. Be patient. Results don't happen overnight, but with consistency and care, they will come. If you're new to strength training, it's totally okay to start with body weight exercises and gradually add resistance as you get more comfortable. If you're unsure where to begin, consider working with a personal trainer, joining a fitness class, or even using a fitness app. These are great ways to learn proper form and stay motivated while building confidence. Next, you may need to consider your schedule and access. Whether you can make it to a gym or need to stay home, there can always be ways to fit in strength training. It's important to also pick the activity you enjoy doing. You will be more likely to stick with it. And your fitness goal doesn't have to be powerlifting. Each training style offers its own unique benefits. You can combine different training methods based on your specific objectives. One of the best tools for designing an effective workout and avoiding plateaus is the FITT principle. It's a simple acronym that helps you remember the key variables you can adjust in your routine to keep your body challenged and progressing. After doing the same workout for a while, your body adapts, and that's when progress slows down. By changing one or more of the FITT components, you can break through plateaus, manage your weight, and keep improving your fitness. When applying the FITT principle to your training, it's crucial to listen to your body. If something doesn't feel right, don't hesitate to consult with your doctor. They can provide valuable insights and ensure you're on the right track to achieving your fitness goals safety. Now, some questions around FITT. F is for how often you exercise. I for intensity is how hard do you work. T for time is how long is each session. And the last T, type, is what type of exercise. Now, as we talk more about the recommendations for strength training, it's important to know some common terminology. A rep, short for repetition, is one complete movement of an exercise. A set is a group of reps done in a row before resting. For example, if you do 8 squats, rest, and repeat that 4 times, that is 4 sets of 8 reps of squats. 1RM is short for 1 rep maximum, and that is the maximum amount of weight you can lift once. You don't necessarily have to lift a weight and find your 1 rep max. You can estimate it using an online calculator, or you can also have someone spot you like a trainer while performing a 1 rep maximum. Now, for some guidelines, frequency. For strength training, most people should aim for 2 to 3 days per week, depending on your experience and recovery time. For intensity, this refers to how hard you're working. In strength training, intensity is usually based on a percentage of your 1 rep max, the most weight you can lift. For beginners, you can start at 60 to 70% of your 1 rep max. For example, if the max weight you can lift at one time is 50 pounds, 60 to 70% of that would be 30 to 35 pounds that you can aim to start with. Then to gain muscle, you might train at 70 to 85% of your 1 rep max, which is, in the same example, would be 35 to 42.5 pounds. To gain muscle, you would use heavier weights at a lower amount of reps. For endurance or toning, you use lighter weights and more reps. Now for time. Time in strength training means the number of sets and reps you do and how long your rest periods are. A typical session might last 30 to 60 minutes depending on your routine. For example, you might do 3 sets of 4 to 6 different movements at 8 to 12 reps per exercise with 30 to 90 seconds rest between sets. And last is type. This could be the kind of strength training you're doing. It could be body weight exercises, free weights, machines, or resistance bands. Choose what fits your goals, experience, and access to equipment. For example, squats, push-ups, and dumbbell presses are all great options. Now next, some common mistakes. Skipping warm-ups and cool-downs. Neglecting warm-ups can increase the risk of injury, while skipping cool-downs can lead to muscle stiffness and soreness. Always include both in your routine. Dynamic stretches incorporate continuous movement. For example, doing arm circles, hip circles, or leg swings are dynamic stretches. Next, lifting too heavy too soon. Starting with weights that are too heavy can cause strain and injury. Gradually increase the weight as your strength improves. Movement should always be slow and controlled, meaning that you can handle the weight without sacrificing form and throwing the weights around. This leads to injury. This is true for both lifting and lowering the weight. Now, poor form and technique. Using incorrect form can lead to injuries and reduce the effectiveness of your workouts. It's crucial to learn and maintain proper technique for each exercise. If you are unsure, consider speaking with a trainer about proper form or take an exercise class. And last, inadequate recovery. Overtraining without allowing sufficient recovery time can lead to burnout and injuries. Ensure you have enough rest days and prioritize sleep and nutrition. The American College of Sports Medicine recommends 48-hour rest between sessions for each muscle group. Next, let's talk about 3 pillars that often get overlooked. In strength training, macronutrients, hydration, and sleep. These are just as important as lifting weights when it comes to building strength and recovering properly. First up, a balanced diet. These are your carbs, fats, and proteins, and each one play a unique role in your training success. Think about food as fuel. Carbohydrates are your body's main energy source. Fats are essential too, and they're key for muscle growth. They also help keep your joints healthy and functioning smoothly. And lastly, protein is also crucial for recovery and energy metabolism. It might seem simple, but staying hydrated can make a huge difference in your performance and recovery. Water helps regulate your body temperature, lubricate your joints, reducing the risk of injury, and it transports nutrients throughout the body. Drink water consistently throughout the day, not just when you're thirsty. And after a workout, make sure to rehydrate, especially if you've been sweating a lot. Finally, let's talk about sleep. It's probably the most underrated recovery tool out there. If you're not sleeping enough, your recovery slows down, your performance drops, and your risk of injury goes up. And according to the CDC, aim to 7 to 9 hours of quality sleep every night. Try to keep a consistent sleep schedule and create a restful environment, dark, cool, and quiet. Lifting weights is only part of the equation. What you eat, how much water you drink, and how well you sleep, these are things that can turn hard work into real results. Without being mindful of these, they sometimes can lead into a plateau. Now, some common signs of a plateau is no progress in strength or area of focus, feeling that workouts are too easy or hard, decreased motivation, and persistent fatigue/soreness. When you hit a plateau, it's tempting to overhaul everything, but that can backfire. Instead of making big sudden changes, try small strategic adjustments. Your body might just need a slight tweak, not a total reset. Tracking your workouts, nutrition, and even sleep can reveal patterns you might miss. Are you lifting the same weight every week? Are you skipping rest days? Keeping a log helps you spot what's working and what's not. Fitness apps, smartwatches, and trackers can give you real-time feedback on your performance. They can help you monitor progress, set new goals, and stay motivated when your routine starts to feel stale rather. Sometimes a plateau means your goals might need a refresh. Maybe you've already achieved your original target or it's no longer motivated. Take a moment or reassess what you're working toward and why. And it's only temporary, never give up. If you've been doing the same exercises, reps, or schedule for weeks, your body is likely adapted. Try changing your rep range, adding new movement, or switching training styles to challenge your muscles in new ways. Now, some of our takeaways here is strength training can help improve strength and endurance. Start slow and progress gradually. Use proper form and prioritize safety. Choose exercises that align with personal fitness goals. Apply the FITT principle to keep your routine effective and anticipate plateaus and obstacles. Next, here's some references here. These references may be beneficial if you are looking to learn more about strength training. Now, for any questions, you can ask them in the chat, and we will give you an answer in a timely manner. And here are some resources here. My name's Garrett with Geisinger Health and Wellness. Thank you for joining this Wellness Wednesday.